Hello everyone, I am Angela Maylino, a nursing student from PLT College Incorporated. Now, I will demonstrate the insertion of an intermittent or indwelling urinary catheter. So, before we start, this is the safety considerations that we are going to do. First is to perform the hand hygiene. Second is to check the room for additional precautions. Third is to introduce yourself to patient. Fourth, confirm the patient ID using two identifiers such as asking what is her name or etc. Explain process to patients, offer analgesia, bathroom, and etc. Listen and attend to patient cues. Ensure the patient's privacy and dignity. Assess the ABCCS, suctions, oxygen, or safety. Apply the principles of asepsis and safety. Check the vital signs and complete the necessary focus assessment. So before we start, I will perform my hand hygiene. So, verify positions, order for catheter insertion, assess for bladder fulfillment, and pain by palpation or by using a bladder scanner. So, position patients prone to semi-upright with knees raised, apply gloves, and inspect perineal region for arrhythmia, drainage, and other. Also assess perineal anatomy. So, assessment of perineal area allows for determination of perineal condition and position of anatomical landmarks to assist with insertion. Hello, good day ma'am. I am Angela Maylino, your nurse for today. What is your name? Okay, good. And what is your birthday? Okay. Ma'am, may I remove your blanket and to check your stomach? So, after assessing the bladder of the patient, remove the non-sterile gloves. And you can perform the hand hygiene. Removing the non-sterile gloves is to prevent the transmission of microorganisms to your hand. Then, fourth step of the catheterization is to gather the supplies. This is the sterile gloves, and this is the catheterization kit, the cleaning solution, and the lubricant if this is the lubricant. Then, this is the prefilled syringe and for balloon inflation as per catheter size. Then, this is the urinary bag that we're going to use and the Foley catheter. So, let us prepare the sterile film. So 5 is to check for size and type of catheter or Foley catheter and use the smallest size of catheter if possible. So the larger catheter size increase the risk of urethral trauma. Let's put a solution. So place waterproof pad under the patient. So the step to prevent soiling of bed liners, place the waterproof pad under the patient. So 7 is the positioning of patients depend on gender. So my patient is a female patient. So on back with knees flex and thighs relax so that the hips rotate to expose the perineal area. Alternatively, if the patient cannot abduct leg at the hip, patient can be side lying with upper leg flexed at knee and hip supported by pillows. So, the patient should be comfortable with perineum or ease and safety in completing the procedure. So, place a blanket or sheet to cover patient and expose only required anatomical areas. This step helps protect patient's dignity. So, apply clean gloves and wash perineal area with warm water and soap or perineal cleanser according to agency policy. So cleaning removes any secretions, urine and feces, and reduce risk of cow tick. So ensure adequate lighting. Adequate lighting helps with accuracy and speed of catheter insertion. So I will remove my gloves now and I will perform my hand hygiene. So hand hygiene, this reduces the transmission of microorganisms. Perform hand hygiene. So 12 is add supplies and cleaning solutions to catheterization kits and according to agency policy. So this step ensures the preparation and organization for the procedure. So if using indwelling catheter and closed drainage system, attach urinary bag to the bed and ensure that the clamp is closed. Here. And the urinary bag should be closed to prevent urine drainage, leaving bag. This is the urinary bag. So, apply the sterile gloves using the sterile technique. So, this reduces the transmission of microorganisms. So 15 is to drape the patient with drape found in catheterization kit, either using sterile gloves or using ungloved hands and only touching the outer of the edges of the drape. Ensure that any sterile supplies touch only the middle of the sterile drape, not the edges, and that sterile gloves do not touch non-sterile surface. Drape patients to expose perineum or the the outer 2.5 cm is considered non-sterile on a sterile drape. Cover the patient with the sterile drape. Using a sterile syringe. So place a sterile tray with catheter between patient's leg. So the sterile tray will collect the urine once the catheter tip is inserted to the bladder. So let us clean the perineal area. So my patient is a female, so to separate the labia with fingers on the non-dominant hand, now contaminated and no longer sterile. Here. So using the sterile technique and dominant hand, clean the labia and urethral meatus from clitoris to the anus, and from the outside labia to inner labia, folds and urethral meatus. So use a sterile forceps and a new sterile forceps and new cotton swab with each cleansing stroke. So this step is to reduce the transmission of microorganisms to cleanse the perineal area. So pick up the catheter with sterile dominant hand, 7.5 to 10 cm below the tip of the catheter. So holding the catheter closer to the tip will help to control and manipulate the catheter during the insertion. So let's start. Lubricate the tip of the catheter using the sterile lubricant and include in a tray. Or add lubricant using the sterile technique. So the lubrication minimize the urethral trauma and discomfort during the procedure. So check the balloon inflation using a sterile syringe. This maintains sterility of the catheter. So insert the catheter as follows. So my female patient, so ask the patients to bear down gently as if to void to help the exposed urethral meatus. So advance catheter to 5 to 7 So note, if the urine does not appear in a female patient, the catheter may be in the patient's vagina. So you may leave catheter in vagina as a landmark and insert another sterile catheter. So 22 is place the catheter in sterile tray and collect the urine specimen if required. So slowly inflate the balloon for indwelling catheters according to catheter size using a prefilled syringe. This is the prefilled syringe. And the size of balloon is marked on the catheter port. So slowly inflate the balloon. So, after balloon is inflated, pull gently on catheter until resistance as is felt, and then advance the catheter again. So, connect the urinary bag to catheter using the sterile technique. So, keep the urinary bag below level of patient's bladder. Connect the urinary bag to catheter using the sterile technique. So, secure the catheter to patient's leg using the securement device at tubing just above the catheter bifurcation. So, securing the catheter reduces risk of calcite, urethral erosions, and accidental catheter removal. Last, I will remove the sterile drape. Dispose of supplies following agency policy. This reduces the transmission of microorganisms. After that, I will cover my patient. And lastly, I will remove my gloves, my sterile gloves, and I will perform my hand hygiene. So 29 is to document the procedure according to agency policy, including the patient's tolerance of procedure, any unexpected outcomes, and urine output. Then timely and accurate documentation promotes the patient's privacy or safety of the patients. That's all. Thank you for watching. Again, I am Angela May Lino, a nursing student from PLT College Incorporated.